Millions of people are affected with mental health challenges today, yet these conversations are often left in the shadows. Today, we will be highlighting an important topic and shedding light on it, a topic that many find confusing and even intimidating. This topic is psychiatric medications. As a pharmaceutical technician, I have seen the impact of psychiatric medications on patients up close. So today we will be highlighting, clarifying any misconceptions around this topic. Whether you are a patient, a caregiver, or simply curious, these discussions and conversations will help you to give you some clarity and a better understanding, and bust a few myths and give you a professional perspective from someone who is on the front line of mental health care. We have with us today Dr. Azra, psychiatrist practicing in Dar es Salaam, Tanzania. Thank you so much for joining us today, Dr. Azra.
Thank you, my pleasure.
So, as a pharmaceutical technician, I have seen the impacts that medications, psychiatric medications, have on patients up close, and there's a lot of misunderstandings and stigmas around the usage of these kind of drugs. So, I'm really excited to learn get some facts across to the people and to the masses about these medications, burst a few myths, and bring some clarity to the topic. So I would really like your help on, shedding some light on that in layman terms as much as possible for our viewers today.
So when we are talking about psychotropic or psychiatric medication, we are basically referring to medications that work on your brain, and they basically alter your thoughts, your moods or emotions, and your behaviors. And they do that by changing up the brain chemistry.
Okay. Okay, so can you maybe walk us through some of the types of the psychiatric medications?
So these medications are commonly used to treat mental health illness or disorders, if you will. And we have the most common groups, which are antidepressants. So antidepressants uplift your mood, and they're also used to treat anxiety. You have antipsychotics, which are used to treat perceptual disturbances, so things like delusions, hallucinations, okay? You have anxiolytics, which are used to treat anxiety, okay? You have stimulants, for example, which are especially used for ADHD. And you also have mood stabilizers. So these are used to regulate moods, from the extreme poles of being in a manic state and depressive state, and so they regulate that switching.
Yeah, so these psychiatric medications, there are myths going around that, they can be, addictive. So these are concerns that a lot of people have about taking psychiatric medications. There's a lot of taboo and a lot of stigma surrounding taking these medications due to these so-called addictive properties, a myth. So what is your take on that?
So, people usually often interchange the use of the word addiction and the word dependency. So when you're talking about addiction, you're referring to mostly a substance causing a dopamine rush or releasing of the happy hormone. And if you don't take that substance, you start getting cravings. And initially it might not cause withdrawal, but then with time it causes withdrawal. But with dependency, it's basically your body getting used to something. So you may take an example of caffeine, if, for example, you're used to taking a cup of tea or coffee every morning, and if you don't get that, you might wake up with a headache, okay? So that's what it is. When you discontinue it, you may get some kind of withdrawal symptoms, not necessarily a state, and you may have those symptoms presenting for a while before your body learns to adapt. Okay, so it's not comparable to substances of abuse, for example. That is the difference. And moving on with that, when you talk about addiction, the simple answer is no. They don't make you addicted in that way. But when you start, and that is where we will come to the importance of gradual tapering, when you discontinue the medications, it shouldn't be abrupt. So if all of this is under the care of a healthcare professional, it's supervised, you will not have to go through that withdrawal, because it will be gradually tapered down, so that your body can adjust to it.
Okay, so from what I understand is it's not necessarily addictive. It might cause some dependence, but what we need is a healthcare professional intervention to prevent these sorts of withdrawal symptoms and whatnot. So yeah, that's a myth busted for us all, that it's not really addictive. It's just causes dependence. So what is the importance, like you talked a bit on tapering, so
Yes.
what's the importance on tapering?
So you see, with these medications, both initiation and discontinuation, they have to be very supervised. So for example, I always tell, this is my general statement always, that don't take these medications if you don't have to, especially if you're not supervised. And when you stop, don't stop them or don't abruptly discontinue them, especially without a healthcare professional being involved. It should be done under guidance, under supervision. If you do that, you might suffer from that, what you may call withdrawal, especially for some medications like diazepam, for example, benzodiazepines, which people commonly, have a general term for it. They call it Valium.
Yeah.
Okay, so especially those, you might get rebound symptoms. So when those symptoms come, the anxiety comes, the depression comes, it's severe and intense as compared to what you had previously. Okay, you might even suffer from a medical emergency. So for those who are taking high doses, again, I'm using the same example of Valium, if you abruptly discontinue it, you might even get a seizure. Okay, so that should be done under the guidance of your doctor, under the supervision of your doctor. Please do not attempt to do that on your own. Another thing is also the compliance. There are some patients who prefer taking medications on and off, like they'll take it today, tomorrow, so the compliance is poor. That is also very dangerous because it can cause the same things.
Okay. Yeah, so someone has to basically like adhere to the the drug usage and compliance and whatnot.
Yes.
So do these drugs, like, do they act immediately, so on the onset of like the prescription, and when it's prescribed by a health professional and the person starts taking it, how long does the drug take
to work
on the body?
So basically, these medications are not like antibiotics, if you will. They don't work immediately. They take time because they are working at the genetic level, and sometimes it may take up to 4 to 6 weeks. Yeah.
Oh, so the mechanism of action, it states the whole
Yes,
genetic
because of the way they work.
Yeah.
They take time because they work at the genetic level. They work slowly. Okay.
So within that time frame, you said like of 1 week, 2 weeks. So how do you ensure that a patient stays consistent and hopeful within that phase, to allow them to actually continue using the medications, because most of us patients that we see, even when it comes to antibiotics, there's a lack of adherence, and we notice problems like antibiotic resistance and whatnot. So how would you, as a psychiatrist, when you come across these patients, how would you what is your advice to patients on how they should be consistent in that time frame until the drug actually starts to work on the body?
That's a good one. So the very most basic thing that you must do is psychoeducation. Psychoeducation and adherence counseling. You have to do that. You have to explain to the patient that, look, this is going to take time. I don't want you to lose hope in the meantime. Just let me know of any changes when you notice them. Try to follow up regularly, okay? Don't give up hope, because if this doesn't work, we can always make changes in the dosages. We can adjust the dose. We can switch the medication class, so we can give you something else. So don't give up hope, just keep monitoring yourself. So mostly when patients know this, they are very cooperative. But if they don't know this, then they are very likely to just drop the whole treatment plan.
So that's the power of knowledge, basically knowing.
Yes.
Once a patient knows that with regards to like the adherence, and they are more likely to be consistent with the plan.
Yeah.
So with regards to like switching of the medication that you mentioned, like at what point would you know that it's better to switch the medication, or what are the maybe symptoms that occur as a result of using these psychiatric medications?
So if you are talking about switching, it really depends. Most of the time, one of the reasons for switching would be intolerable side effects. So if you have started using, for example, amitriptyline, you cannot tolerate the side effects, you are excessively drowsy, we can switch you to another class of medications. That can be done. Another reason is non-response. We don't see you have been there for the 4th week, the 6th week, maybe even the 8th week, there is no response. That is also another indication to change the class of the drug.
Okay, so if this medication like works best with one person, will it work the best for, is it like one fits all kind of thing, or is it like different to each person?
It's definitely not one size fits all, you know, because everyone's brain chemistry is different. Okay, so there are a lot of factors, we call them prognostic factors. Okay, so let's take person X and person Y. You may give them the same, they might be diagnosed with the same disorder, and you may give them the same dose of medication, but they respond differently. Okay, so because it depends on a lot of, it depends on genetic factors. So it also depends on environmental factors. How good is the social support? It depends on the medical and psychiatric history. Is this their first episode? How many times have they been, you know, affected before? How many times this? What number of episode is this? How is the family history? Is there something running in the family as well that could be like a loading factor, genetic load? Okay. For example, is there a cause? And very strangely enough, people usually think that if there is a cause, the prognosis is poor. It's not true. So let's say if you had recently a loss of a loved one in your life, and a few months down the line you are diagnosed with clinical depression, okay? That is actually better when you compare it to somebody who is diagnosed with clinical depression without any, you know, potentially, or without any identifiable factor, you see? So those kind of things, it really depends. So it won't work the same for everybody. The timeline won't be the same for everybody, okay? One of the common questions is also that patients have is, do I have to take it forever?
Yeah.
Okay, or how long do I have to take? That is also subject to all of these factors, okay? So if this is your 3rd episode, and sometimes it also depends on the type of illness, okay? So if it's schizophrenia or it's bipolar disorder, most likely it will be long term. If it's the first episode of clinical depression, most likely we will give you a trial of, you know, getting you off medications.